Sorry, we didn't realize we were live.
So we're
just going to start right now. We were having some technical issues. So
see you.
I'm Mona Locke. Welcome to Swedish Facebook Live. Swedish is the largest nonprofit healthcare system in Washington State, based right here in Seattle. And we have a really timely topic for you today. July is BIPOC Mental Health Awareness Month. And so we think it's a good time to discuss that. And BIPOC, Black, Indigenous, and people of color are often faced with years, even generations of trauma. And that trauma oftentimes leads to socioeconomic disparities and mental health issues and even premature death. So when you add to that the George Floyd murder and Breonna Taylor and subsequent news that's been in the media nationally, the Black Lives protests, as well as the continuation of COVID and the infection of COVID, there's a whole host of emotional trauma that is facing all of us, but really, especially more so, the BIPOC communities. So we have some special guests joining us today. I have the Executive Director, Medical Director of Swedish Behavioral Health, Dr. Arpan Wagre, and we will also have racial trauma therapist Ashley McGirt with us today. So thanks to you both for taking time out to be with us today. And I wanted to start with Ashley, first of all. You focus really on racial trauma. Tell me about your life and what drew you to this focus.
Yeah, so I'm a Washington native, born and raised, and it was really through my experiences growing up here in Washington State that led me to do this work. So as a child, I really aspired to be an attorney, but then my grandmother died, and I ended up having to go to the school counselor because I was experiencing a lot of grief. And during my sessions with my school counselor at the time, I found that I really had to explain a lot of what it meant to be a Black child here in America. I had to explain to her the role of grandmother in African American families, and it was just a lot of education, so I never actually got the healing that I needed, and then my grief actually turned into major depression. So I started studying psychology and just learning how can I actually improve my own mental health and well-being, because I figured there had to be other Black kids, other Black people who were experiencing the things that I was experiencing, and no child should really have to educate their counselor on what it's like to be a Black person. So that's when I really started understanding what it means to be culturally responsive and show up. And that's how I got into this work. And then also, so I've taken a number of paths. Even now, currently, I serve as a hospice clinician, and then I also have my private practice where I focus on racial trauma. But that also stemmed from my experiences here in Washington State, where I served as the director of social services for a large healthcare facility and experienced a lot of racism. My physical health was impacted, and so now I really work directly with individuals who have experienced race-based stressors that impact their physical health and their mental health, so that they can actually find ways to live better, because we know racism is not going to end tomorrow.
And what kind of impact has that been? I mean, why is it important to have BIPOC Mental Health Awareness Month?
Well, it's important, one, to understand the history, because in order to even understand why this event is important, you have to understand the history of BIPOC Mental Health Month, which actually was initially named Minority Mental Health Month on a national level by B.B. Moore Campbell. And she was a Black woman who served her community relentlessly up until the day that she died. And I love the passion that she had. And she recognized that the individuals in her community, which was a rural community, it was predominantly Black and brown. Many of them were low income, and oftentimes the symptoms that they showed ended up having them be criminalized, misdiagnosed, or overdiagnosed. So she fought really hard alongside NAMI to ensure that they received adequate mental health services and treatment. So it's really because of the works of B.B. Moore Campbell that we actually have Minority Mental Health Month, or what we now want to call BIPOC Minority Mental Health Month, so that we can celebrate the efforts of Black clinicians, Indigenous clinicians, and other people of color, as well as those communities that we serve, because every single person walking this earth has mental health, and 1 in 4 of us has a mental illness. Those numbers are probably even higher as we're experiencing a global pandemic right now. So it's important to have these conversations and highlight people of color.
And thank you. And as a housekeeping reminder, if you have any questions, please chat them in, and we will try to. We were having some technical issues, but we'll try to answer them real time. Dr. Wagre, I want to turn to you now. With everything going on in this space, especially during this month, what do you say to the say non-Black community, the white community, the allies, people who want to help? How can they support and kind of give us some context, if you know, of what could be going on in other people's lives too?
Yeah. Well, thank you, Mona. And Ashley, thank you so much for sharing such a rich personal journey that you've experienced in all your phenomenal work. You know, I want to first take a step back and help people kind of build a little bit on what Ashley described, you know, about 1 in 4 people. Like, how big is the problem with mental health? What are we really dealing with? So if we take a step back, I think it's important to recognize a few important things. For the last 3 years, the very first time since 1920, over the last 3 years, we've had a decrease in life expectancy in the United States of America. We have people dying younger and younger, and this is directly related to deaths of despair by suicide, opioids, and alcohol. 1 person dying every 3.5 minutes. Now, there are multiple factors that contribute to this. There are individual level factors of loneliness, lack of belonging. There's health system care fragmentation, stigma, access, lack of access to culturally competent care. But then there are societal issues. There's intergenerational trauma. There's inequitable division of resources. And these directly factor into some of the things we're seeing. And I also want to call out that, well, the burden of deaths of despair are not evenly distributed. There are populations that are suffering more. And so, for example, indigenous people, Alaska Native American Indian population have a 2.6 times greater likelihood of dying from deaths of despair related to alcohol use compared to the general population. We think about, you know, our youth. You know, many people don't recognize, but suicide is the 2nd leading cause of death in young people aged 15 to 24. Now, if that youth identifies as LGBTQ+, their risk of dying by suicide is 2 to 7 times higher. So the point of all of this is that we do have to understand that there are some groups that are disproportionately impacted. And of course, we care about every single life. We want everyone to thrive and realize their fullest potential. But I think as we think about this and where we're at, we need to take a step back and say, who is not thriving? And what can we do collectively to help change that?
Yeah, and Ashley, I'm going to ask you, I know you have some personal stories about the stress and what's the end effect on people that you have loved.
Yeah, so the end effect is death. And we see this when we look at the disproportionate rates in which Black people and other people of color are dying. And COVID is really exposing some of the things that we have already known existed, but they haven't been shown or exacerbated on a global level as they are now. Because right now, if we look at COVID, we know that 1/3 of the COVID hospitalizations are Black people, yet we only make up 13% of the population. And I attribute this a lot to systemic racism. Even when it comes to our overall health rates and our mortality rates, Black women are more likely to die in childbirth, more likely to die from a stroke, diabetes, heart attack. My own grandmother, she passed away at 62 years old from a stroke. And as a hospice clinician, I see that the majority of my Black and brown patients are extremely young, ages varying from 30 to 65, whereas my white hospice patients are living well into their 90s. I even had a 103-year-old last month that we actually had to discharge from hospice because they weren't showing signs of actively declining. So I want everyone to really recognize how this impacts people of color, especially Black people, because we are dying. And if we don't make systemic changes, then it's really going to result in high mortality rates. Even here in King County, let's take a look at COVID and where it started. It started in Kirkland, which is a suburban community, which is predominantly white. And now we're seeing that the most impacted by COVID are Black and brown communities. There's a quarantine facility a mile from my home in South King County in Kent, Washington, which is one of the most diversest cities in the nation. So the fact that we would actually take a virus that was in a white neighborhood and then put a quarantine facility, move that virus to where predominantly people of color live is racial trauma. This is impacting our mental health. When we're watching on the news day in and day out, and I'm seeing that people who are impacted by this virus look like me. And even take coronavirus out of the picture, I know that most people who have high blood pressure, chronic heart failure, they look like me. So as a Black person in America, things look really bleak. So I have to really work hard to actually improve my mental health and the mental health of my community. So that's why BIPOC Mental Health Month is really important, so that we can show people of color that we need to prioritize our mental health even when things look extremely bad, because they are bad, but there's still things that we can do to improve our mental health, our well-being, that can ultimately help us live longer, so you don't have to end up on my hospice caseload at 30 years old, 45, or in your 50s like my two uncles who passed away last year.
Well, I mean, that's a pretty urgent call to action. So let me ask you, what are some tangible steps that people can take to help with the mental health?
Well, I'm a therapist, so I'm definitely going to advocate for therapy, but I understand that it's hard to find a culturally responsive clinician, especially here in Washington State, which is why I recently started the Washington Therapy Fund Foundation, which really seeks to eliminate some of the barriers to Black healing. I've connected to a number of different Black therapists in Washington State who are trained in racial trauma and are able to help the community heal. And because we know there's a lack of Black therapists available, I've actually worked and partnered with some non-Black therapists who have been trained in racial trauma and are skilled and not able to continue traumatizing these Black people in the community who really need help and healing. So they're available. And so that's one resource. And also I recognize, not everyone is going to go to a traditional therapist and do talk therapy. There are healers in our community. Indigenous people have found ways to heal before therapy was a thing. So tapping into that, grounding into this earth, planting your feet on the Duwamish territory, the soil that we walk through each and every day, whether it's Reiki, meditation, going out on walks, but moving. It's extremely important to move our bodies, especially now in the middle of a global pandemic, because stress and trauma stores itself in the body, and then it manifests itself in the things that I mentioned earlier, the high blood pressure, chronic heart failure, all of these things that are ultimately killing us. So we have a duty individually to move, to work, and to heal ourselves so that we can thrive and be here.
Dr. Wagre, I have a question for you. What steps do you think we need to take to help end systemic racism in healthcare and in behavioral health?
That's a great question. It's it's a tough one. Before I get to that, I just want to build on a little bit of what Ashley described. And when she was talking about her own family members dying younger, and people she's been caring for in the hospice teams dying younger, I think it is really important to recognize that it's unfortunate, but your zip code, where you live, your zip code has the ability to predict how you're going to do, how long you're going to live, more so than your genetic code. So people might be living just 2 miles away, but in a certain zip code where there's lack of resources for good, healthcare access and very basic things, and they can die 20 years younger. So I do think it's important to recognize that. Now to ask, I'm going to answer your question in 2 parts. One is, I do think it's important to call out the racial inequity that exists, right? It is there, call it out. Now, as we think about this, the way I would approach this is that rather than saying people of color are having poor outcomes and dying sooner, I would say our systems are designed in a way where people of color are having poor outcomes. So what that does is it allows us to bring continuous process improvement and the ability to bring and apply an equity lens so that we systematically improve and get to the bottom of everything we're dealing with. Now, I'm an eternal optimist, and so despite all the challenges we're facing, I do want us to think about the fact that when we focus on patients, on people that are marginalized by the system, and you improve the systems for them, it improves things for everyone. So let me give you an example. Anyone out there who's a young parent, who's ever recently prior to COVID, taken their child, their little one out in a stroller, and they're walking on a sidewalk, and they come to a traffic light. Your baby's sleeping, and you have this beautiful sloped curve by the traffic light, that curb cut, and you're gently able to navigate your child over that, does not wake them up. Now, for a moment, think about that. You take that for granted today. But that was not always the case. Those curbs were not always cut. It took a big fight. It took change that happened because people on wheelchairs, all the way dating back to 1945, World War II vets, and subsequent, to get to a place where they had equal ability to have mobility, just the basic thing. And so when those people who were marginalized were brought in the center of this and things were done to make things better for them, it made things better for all of us. So that's the approach that I do think we're going to have to take.
Does it have to happen within healthcare itself, or can those on the outside actually demand or help move us forward?
I think it's absolutely both and. I mean, what happens in healthcare, the influence of the healthcare system on the health outcomes is about 20% of what happens. So what happens to our health, 80%, 70 to 80% of that is outside of the healthcare delivery system. So I think it's the responsibility of every one of us.
Okay, Ashley, any thoughts on that?
Yeah, I agree. I definitely think it's twofold, where it's our duty individually, collectively as a community, and it's also in the healthcare system. But we have to advocate. We have to demand for changes on a legislative level. Even talking about mental health, we need to change the way that we treat mental health. Right now, we treat at a crisis-centered level. We don't look at preventative mental health services. So insurance actually will not even reimburse me to see you if you don't meet a diagnosis that's actually in the DSM, because they're going to feel like it's not appropriate level of care, whereas I have to actually give you a diagnosis. So say you have a mental illness, and I'm not going to just make it up, so you would actually need to meet something in the DSM in order to be reimbursed. Otherwise, you're going to have to pay out of pocket. And it's really unfortunate the way that the healthcare system is set up in that way, because everyone can benefit from therapy, and you don't necessarily have to have a mental illness or something, be in a crisis mode to actually speak to a therapist. Just having someone who has a non-biased perspective, who can actually help you to improve your mental health, is necessary. And I actually believe that the world would be a better place. But then again, it comes back to the issues of cost. Not everybody can afford $125, $200 a session. So then what does that say? That tells us that mental health is just for the wealthy. And that's not how it should be. So we need to demand changes from the way that insurances work, the way that we treat, the way that we even diagnose. Because if a Black man comes into a psychiatric facility with the same psychotic symptoms as a white man who shows up, the white man is more likely to be diagnosed with bipolar, whereas the Black man is more likely to be diagnosed with schizophrenia. And why the difference is? Well, bipolar is something that's more manageable, and we tend to see schizophrenia as a disease that's episodic. It's something that a lot of people fear in the community, and then it continues to perpetuate that fear that we have of Black men in the community, which then leads to Black men being over-criminalized. It leads to situations like George Floyd having a knee to his neck for 9 minutes and 46 seconds, and just the fear that's continued to be perpetuated around this country about Black people. So yes, a lot of changes, and we're all voters. Well, many of us. If you're not a voter, you definitely need to register to vote and make change. And, we pay taxes. So we contribute to the healthcare system in a number of ways. So it's on us as a community, as well as those who work in healthcare.
Yeah, you're really talking about exercising your voice. And to that, a reminder to chat in any questions you have. There is a comment here that we must find cultural responsive therapists, and I want to bring up how does one look for finding a culturally responsible therapist? Like, what does that mean, and what should I look for?
Yeah. So it's been really difficult to find a culturally responsive therapist. There are more platforms that are making it easier. So there's a platform which is called therapyforblackgirls.com. You can go there. There's therapyforlatinx.com. Like I said, I created the Washington Therapy Fund Foundation. And on my website, I have a list of culturally responsive therapists. But it's important to actually ask your clinician, have you treated Black people? Have you treated Hispanics? Have you treated the LGBTQIA community? What is your experiences? What are your thoughts around certain things? So to ask key questions so that you can make up that they can show up in a way for you and check their biases, as well as, be able to provide good care. So it's going to be asking a lot of questions, spending time during that free, which is typically free, a 20-minute phone consultation before you even book a clinician, looking at what is it that you're wanting to seek a therapy for. Are you feeling a little down, anxious, depressed? You just want to talk to somebody? Have you lost somebody? Like me in my case, when I lost my grandmother. So it would have been key to ask the person that I seen, what is their experience working with Black children who have lost a grandparent? Because the person I seen had zero experience working with Black children who had lost grandparents. And if she had, she continued to ask me to educate her during my sessions, and that shouldn't occur. So again, just asking lots of questions, finding out what it is that you want to seek, because just because you find a Black therapist doesn't mean they're culturally responsive. Just because you find a Hispanic therapist doesn't mean they're going to be culturally responsive, because we live in a predominantly white society, and white supremacy is embedded 1,000-fold within the culture. And sometimes we uphold those white supremacist ideals and we don't even necessarily know it or recognize it. So that's why you need to make sure the clinician has done some sort of anti-racist training.
Thank you.
The culturally responsive therapy piece is really, really important. I can't emphasize that enough. And I think Ashley called out a few things. The National Alliance on Mental Illness actually put out some of these things on their website. So it actually gives you a sense of how do you empower people with right knowledge, democratize knowledge, so that you're able to ask the right questions of your therapist so you know it's a good fit. It's also important to recognize that it's not about being only of the same culture, and it's about being mindful of your own culture and the cultural differences and being equipped, because there is a higher level of misdiagnosis, underdiagnosis when you're not aware of that. I also want to call out, so the American Psychiatric Association actually has gone a step further and created toolkits and guides to help every psychiatrist out there to educate themselves on different on cultural differences and what's important. I mean, there are things that even medication. So there's different ways in which people metabolize certain medications based on, your culture, your ethnicity. And so there are certain groups of people who might require, you give them a small dose of a medication, but they don't metabolize that fast, and they're at a greater risk of side effects. And there are others that rapidly metabolize the medications, and if you're unaware of that, you're going to say they're non-compliant, and that's what happened historically. So it's really, really important to pay attention to these things and inform yourself, educate yourself.
Yeah, and I don't want to bring it to the kids. When you're talking about, these are just even adults, but what about the kids out there in this generation that are bombarded with these images after George Floyd and the protests, and how do we talk to our kids, and what messages do we say to them?
It's important to really expose our children to diverse communities. Oftentimes we're boxed into our own little neighborhoods. There's people who stay in Seattle and they won't go to Tacoma, and vice versa. So it's important to really get outside of your neighborhood and meet people who don't look like you. It's important to expose your children to diverse arts, diverse literature, media, positive, good media, because we're all reading the same books that we grew up with, and it needs to change. So when we expose our children to other things that are actually positive, it can actually have a positive outlook on their life. I grew up in a predominantly white community, so I never seen Black doctors. Black healthcare professionals, aside from my grandmother, who was a teacher, and my mother, who was a registered nurse, which is why I then actually went to a HBCU, which is a historically Black college and university, so that I could see professionals who look like me, because it's affirming. And it's important not only to Black children, but for white children to see positive images of people of color. Otherwise, they're going to think negative things about them. They're going to think that it doesn't exist. So expose your children. And if you don't know any Black people, there's just no Black people in your community because of where you live, again, look at the media, look to positive literature, books, movies, theater. Once we get out of this global pandemic, travel so that you can expose them to other people, and just have really good heart-to-heart communication, because the children know. The children know exactly what's going on. They see the brutalization of Black bodies, and it's extremely harmful on the psyche of Black children, which is why I love the works of Kenneth and Mamie Clark, who did the doll studies. Basically, they showed a Black doll and a white doll to children and asked them who's more intelligent, who's beautiful. And even the Black children, Hispanic children, every other child predominantly chose the white doll. And this is because of the influence of the media and the way that we socialize our children. So we need to do a better job. Now, this was in the 30s, but the study was replicated again in 2006. Same results. So 2020, what are we doing collectively to expose our children to positive images of people of color so that they do not automatically go to the white doll and think that the white doll is just the most perfect thing?
No, that's a good point. And this has kind of been an uncomfortable space, not this space today, but in terms of the George Floyd protests and culture clashes and all. So I'm going to ask you to kind of embrace that uncomfortableness. And what would you say to the people that are against Black Lives Matter, or feel like we're all people and all lives matter? I mean, what would you leave with them today?
It's important to focus on the most vulnerable in your community, and until their lives matter, no lives matter. Because right now, Black people are suffering, Indigenous people are suffering, other people of color are suffering in this community that was not created with Black people or any other person aside from white in mind. So it's important to really look at the systems and how they uphold these racist concepts. And it doesn't mean that your life as a white person doesn't matter. It just means Black people are dying at disproportionate rates, and there's systemic racism embedded in the culture and in the community that is literally killing people. And it's important to advocate for those lives and show that they matter, because they haven't mattered. And it is an uncomfortable conversation. But you know what? George Floyd was extremely uncomfortable when the officer had a knee to his neck. And the comfort that you have been in, that many of us have been in, leads to Black death. So it's okay to be uncomfortable. We need to be uncomfortable so that we can change, because the way that we've been going at and the normals that this country was founded on is not comfortable for people who look like me, which is why I have a whole host of family members who have died extremely young. And this isn't limited to just my family. It's limited to so many other Black families, so many other Indigenous families, Native Americans. Just looking at the way that they are treated in this country shows that all lives do not matter. So until everyone else's life matters, that's when we can say all lives matter. So yes, Black lives matter, Native lives matter, everyone's lives need to matter. And until I see that, I'm going to continue to holler and shout, Black lives matter.
Great. Dr. Walgray?
You know, it goes back to who is not thriving, and what will it take for all of us to come together to help them thrive, because we want everyone to thrive and to realize their fullest potential. So I think it's a hard conversation. It's hard for so many reasons. I thought I wouldn't share my personal story with this, but I feel compelled to after hearing Ashley pour her heart out and talk about things. When I was probably 6 or 7, I remember walking with my father in suburban Chicago, who's a pediatrician, and we have, four young white men come up to us, and, absolutely unprovoked, one man takes a small knife and throws it by my father's foot. Now, he had no, I don't think he intended to hurt him, but he definitely wanted to scare him. And then he came up, and while he picked up the knife, he said, I'm sorry it missed you, but you should really go back to where you came from. Now, I'm a 6-year-old, 7-year-old kid at that time, and I'm watching this, and in my mind, as 6-year-old and 7 years old, everything is about you. So there was something about me that I did that probably caused that, and there was something about me that I needed to change, but that darn pigment melanin was just more powerful than me. I couldn't change that. I can't change the amount of melanin in me. But what I did, and I had suppressed this memory for many, many years till recently in all this. But what was beautiful and where the hope comes for me is my daughter 2 years ago was doing a passion project as a third grade student or fourth grader. And she asked me the question. She said, why, what's the difference between that person and me, her friend and me, and I talked to her about melanin. And she decided to do a passion project on melanin and talk to people and just drive home a point that we are the same. The only difference is the amount of a skin pigment.
Yeah.
I definitely agree. We're the same, but the way that we're treated is completely different. It's very uncomfortable being a black person in America, being a person of color in America. So when we talk about this level of comfortability, we have to look at the level of comfort that other people of color are experiencing and how it's impacting their mental health. People are anxious, depressed, having difficulty sleeping, nosebleeds, migraines, so many physical symptoms. I've had all of these myself. I know other people of color have experienced these things, and I really appreciate you for sharing your story, because there's so many of us who repress these stories and we forget about it, and we continue to navigate in a society that was not designed for us. So now in 2020, with everything going on, we have the power to look at the way the healthcare system is, look at the way the mental health care system is, and do better. We have to. Our lives depend on it.
Yes, and we're just about out of time, so thank you for your comments. But I usually do a round robin at the end, which just leave me with your thought for the day and what you want people to think about having watched this. Dr. Wagre?
Love, compassion, genuine love, genuine compassion for every single human being.
Wonderful. Ashley?
I want people to know that it's okay not to be okay, and, just reach out to a therapist. There's people out there who are available to help you, and there's resources that are helping to eliminate some of the financial barriers to black people and other people of color getting the treatment that they need.
Yeah, and I guess really what you're saying is you're not alone, right? If you're out there, there are resources, find them, and advocate for yourself first and foremost. We are in changing times, so thank you so much to Ashley McGirt and Dr. Arpan Wagre for joining us for this time. And I just want to say on behalf of Swedish that we have embraced Black Lives Matter because we believe that there are health disparities nationally, everywhere, and until we fix that, it won't get better for all of us. So thank you so much for joining us, and we'll see you next time.